At their core, stem cells are the body's raw materials and are cells from which all other cells with specialized functions are generated. Unlike regular cells like a heart cell or a skin cell which have a fixed purpose, stem cells have two unique abilities which are self-renewal, meaning they can divide and renew themselves for long periods, and differentiation, meaning they can turn into specialized cells under specific physiological or experimental conditions. There are three primary types of stem cells, starting with embryonic stem cells or ESCs, which are derived from embryos that are 3 to 5 days old and are pluripotent, meaning they can divide into more stem cells or become any type of cell in the body, making them the most powerful for regenerating diseased tissue and organs. The second type is adult stem cells or ASCs, which are found in small numbers in most adult tissues such as bone marrow or fat and are typically multipotent, meaning their ability to differentiate is limited to the cell types of their tissue of origin. The third type is induced pluripotent stem cells or iPSCs, which are adult cells like skin or blood cells that have been genetically reprogrammed back into an embryonic-like pluripotent state, allowing scientists to create stem cells that have the versatility of embryonic cells but without the controversial need to destroy an embryo. Part 2. How stem cells are used today. Currently, stem cells are the cornerstone of regenerative medicine, and their primary function in therapy is to replace diseased cells with healthy ones. The most established stem cell therapy is bone marrow transplants, where doctors use hematopoietic stem cells to treat people with blood-related cancers like leukemia, lymphoma, and neuroblastoma. Stem cells are also being used to grow skin grafts for severe burn victims and to repair corneal damage in the eye. Researchers also use stem cells for disease modeling, where they create cell cultures from patients with specific diseases using iPSCs to study the disease's progression in a petri dish, allowing for drug testing without risking patient safety. Part 3. U.S. Laws and Restrictions. The legal landscape in the United States is a complex mix of funding restrictions and safety regulations, primarily driven by ethical debates surrounding embryonic stem cells. The Dickey-Wicker Amendment has prohibited the Department of Health and Human Services since 1996 from using federal funds for the creation of a human embryo for research purposes or research in which a human embryo is destroyed, discarded, or knowingly subjected to risk of injury. Though scientists can do this research using private or state funding, they cannot use federal NIH grants to derive new lines if it harms an embryo. The FDA also regulates stem cell products as drugs, biologics, or medical devices, and the only stem cell products currently FDA approved for use in the U.S. consist of blood-forming stem cells derived from cord blood for limited indications. Clinics often try to bypass FDA regulation by claiming their treatments are minimally manipulated, such as taking your fat cells and injecting them back into your knee. However, the FDA has cracked down on this, stating that if the cells are processed significantly or used for a different function than they performed in the original tissue, they are unapproved drugs and illegal to market. Part 4. Breakthroughs and bioenhancement. We are currently witnessing a shift from treatment to enhancement and cure with recent medical breakthroughs, including a functional cure for type 1 diabetes, where scientists successfully used iPSCs to grow insulin-producing islet cells that began producing insulin when transplanted into patients. Other breakthroughs include restoring vision, where limbal stem cells have been successfully transplanted to repair the cornea in patients blinded by chemical burns or genetic defects, and the development of off-the-shelf therapies where gene editing stem cells using CRISPR makes them invisible to the immune system, allowing for universal donor cells. Bioenhancement refers to using biology to improve performance beyond normal health and includes anti-aging research, where stem cell therapies are being investigated to replace accumulated senescent cells with fresh youthful progenitors to extend the human health span. Athletic recovery is another area of bioenhancement, where banking young stem cells to rapidly repair ligament and muscle tears in athletes is being explored to potentially cut recovery times in half. Part 5. The future of stem cell therapies. The future suggests a move away from pharmaceutical management of symptoms toward biological replacement of systems, including organ manufacturing or bioprinting, where by 2035 to 2040 scientists aim to print new kidneys or livers using a patient's own iPSCs to eliminate the need for immunosuppressive drugs. In vivo reprogramming is another future therapy where mRNA technology delivers instructions directly to cells inside the body to reprogram scar tissue cells into functional cells without removing them from the body. Neuroregeneration remains a major goal where future therapies aim to introduce neural stem cells that can integrate into the brain's complex circuitry to reverse conditions like Alzheimer's and spinal cord paralysis. A potential future medical standard could be the Fountain of Youth Protocol, which involves banking your own iPSCs when you are young and receiving periodic infusions of your own revitalized autologous stem cells as you age to maintain tissue density and organ function.